The endoscopic mid-facelift is a technique that we have been using for the past several years to achieve facial rejuvenation that is subtle, with imperceptible signs of surgery, but that nonetheless actually achieves a very natural-looking rejuvenation and volumization of the face, particularly the mid-face. The technique that we use uses 2 points of access, both of which are carefully hidden. The first are incisions in the scalp that allow us to dissect down to the level of the cheekbone. We then join the tunnel that we make through this access with another tunnel that we create going from the gums inside the mouth. We join these 2 tunnels, and in so doing we release all the attachments and ligaments of the soft tissue of the midface. We then introduce a device, a very ingenious device called an endotine. It's a little bit like a carpet tack that we can affix to the scalp and the bone of the midface. And this allows us to elevate the soft tissues of the midface and then lock them in place at precisely the height and position that we want to achieve the maximal fullness of the malar area or cheeks and the most subtle but aesthetically pleasing rejuvenation of the midface. Once we do this and find the proper position, we fix the endotine in place and then close the incisions inside the mouth with absorbable sutures and then in the scalp as well. These incisions heal usually very finely and become imperceptible. The rejuvenating effect that we achieve is extremely natural, and this is the kind of operation that is especially appealing to a woman, say, anywhere from her mid-30s into her early 50s, who's not quite ready for a full facelift. Maybe the contour of her neck is still looking good, but she's noticed over time that she's lost some of the fullness of her cheeks, and the lower part of her face has become fuller while the upper part has lost volume. This operation allows us to reset and reposition those soft tissues back into the optimal position in the midface, creating a very pleasing rejuvenating effect, but without the surgical stigmata that scream cosmetic surgery. So it's become a very popular and satisfying option for many of our patients.